Let's talk about mastitis. Are you a breastfeeding mother and you suddenly start feeling pain on your breast? It's hard to touch, it's reddish in color, and it's hot when you touch it. Let's talk about mastitis today. And I think the Yorubas call it kokoroyo, and it usually happens in new mothers, sometimes in heavily pregnant women. What is mastitis? Mastitis is the inflammation of the breast tissue, which is caused by block of milk duct in the breast or an infection. The infection part usually occurs when the nipple has a crack due to poor latching of the nipple and areola of the breast to the baby. Mastitis is very common in new mothers breastfeeding. That doesn't mean the woman is dirty, no. Mastitis can happen to any woman. What are the causes of mastitis? Cracked nipples that allow infection bacteria to enter the breast from poor latching of the nipple and areola to the baby. Skipping feeding. When you skip feeding, the milk starts building up. It's just like you putting the normal milk in a place, it starts clogging. That is what happened. Milk not being removed effectively. For the mothers that pump out their milk in order to feed their baby later, poor pumping can also cause a blocked duct. Also, poor latching. We need to make sure our baby is properly latched to our breast by having the nipple and the areola right in their mouth, properly latched in their mouth. That really helps. How do you know you have mastitis? When your breast suddenly start becoming hard to touch, when you start feeling pain, you start running temperature, sometimes you feel cold all of a sudden, and when you touch your breast, it's very hot and it's like reddish in color, then you might have mastitis. But there is nothing to be scared of. It's not a death. In fact, it is not a serious matter at all. Let's dive in. What to do when you sense you have mastitis? Relax and stay hydrated. Continue breastfeeding from that exact affected breast. Yes, I said it. Try to breastfeed from that exact breast as much as you're comfortable with, but it really helps from baby sucking from that affected breast. Use pain relief like ibuprofen or acetaminophen if medically advised, and which one is safe for breastfeeding mother. When do you have to seek medical intervention? When it goes beyond 24 to 48 hours, yes, you need to seek a medical intervention because that might be something else, especially when the lump persists and the symptoms is getting worse. People might tell you, don't give the baby the breast that is affected, it might affect the baby. No, even if you call your doctor or your health caregiver, they would advise you to feed from the affected breast, because we talk about mastitis is either a blocked milk duct or an infection. The infection part doesn't affect the baby. In fact, it is highly recommended to feed from that part of the affected breast so you can get a clear and true passage from the milk duct. Also, not all breast pain is mastitis. Don't panic. Always consult your health caregiver and be very wary of what you use from neighbors and this has happened to me before. Be careful. The word then is not the same as the word now. It's totally different. Stay hydrated and don't panic. Mastitis is not even something to worry about. Thank you. Have a nice day.